Welcome, guys. We have an interesting topic to discuss today: ethical decisions faced by paramedics and patients unable to speak the same language. So, this talk is based on ethics. Super fun, super controversial, bit of grey area involved with ethics. Ethics isn't necessarily our morals, our beliefs. Ethics can be revolved around a religion, sport, law, and in this case, paramedics, ethics in health. So, what is ethics? It can be described as the study of the moral lives and actions of people against a normative basis that provides insight into who we ought to become and how we ought to act in relation to others. Put it in another sense, ethics is based on well-founded standards of right and wrong that prescribe what humans ought to do, usually in terms of rights, obligations, benefits to society, fairness, or specific virtues. So I like to put it in a nutshell is ethics isn't that's right, that's wrong. Ethics is what should we do, even if this is right and this is wrong. So it's a decision process. It's not necessarily right or wrong. So obviously, it's about fulfilling obligations in society, and what we should do, and that's why issues come up with paramedics all the time to do with ethics, because their obligation, their ethical duty is to do whatever in their control that can both reduce their patients' discomfort and keep them alive, and this can mean giving medical treatments proven to help rather than harm patients. So with a paramedic having this obligation, ethics comes up because they need to decide what's right for a patient. So to guide paramedics in this process, obviously they go and do a lot of training at university to learn how to help patients physically, but in terms of what's right for that individual, they need to follow some sort of guideline to help them, not only to help them make their own decisions, but also for the public to be aware of guidelines that they follow so that they are trying to do the right thing by the public. So APRA, Australian Health Practitioner Regulation Agency, put out a code of ethics for paramedics to follow. They put out a code of ethics for most health professions, and they just list various things of the rationale and the role of paramedics, and that is to give care to patients, and to do all within their might to see them healthy and alive when they're taken to hospital, but at the same time following a list of protocols so that they're making the right decisions by each individual patient, not just a blanket rule. So these guidelines also follow principles of ethics that ensure patients are treated as individuals rather than a set rule book. But obviously, even following a set of guidelines like this, there's issues that are going to reoccur a lot that are common. So a couple of these include maintaining privacy for the patient. A lot of the time, medical records need to be given out to other people, such as law enforcers or other medical staff, and sometimes this can be seen as a breach of confidentiality. But at the end of the day, if while the situation is unfolding, this information does need to be divulged, it's what needs to be done, even if it's technically not by the rule book. They need to be acting justly and with integrity. So when we're talking about this, we're talking about paramedics see multiple variety of people every day. So they obviously need to be acting in a way that doesn't show bias or better treatment to some people when maybe innately they want to. So this is also another issue that often arises within paramedics doing their jobs. And one of the biggest ones is actually ensuring consent from the patient or the patient's family or whatnot. This is the big one in terms of allowing treatment to occur, because there's a lot of people that don't follow the norm in terms of medical treatment. Often this is in religious or cultural groups. So for instance, Muslims don't like other genders touching each other, Hindus require lots of rituals around death. Christians might reject some medical help. And for instance, even old people who don't want to be resuscitated, like extreme measures. So it's really important when seeking consent to ensure that this happens, because even though your job and your obligation is to fulfill a role to keep them alive, if they don't want certain things, that is up to them. So it really needs to happen. Which leads me to the case study of this talk, especially when they don't speak the same language. They sometimes find it very difficult to seek consent from a patient or the patient's family. So this case study happened in Salinas Valley in California. This is an area with a lot of indigenous population from southern Mexico. And they're very culturally sensitive with who knows what about their medical state. And first of all, they don't speak English, so a lot of them don't, so it's hard to communicate this. They're also culturally sensitive about what they're allowed to do in terms of their native tongue, and just like a lot of rules around that. So this instance, a 1-year-old had a heart attack, and to counteract for this, because of her fatal congenital heart failure, they put in a pacemaker without seeking proper consent, because of this area they don't have enough money for interpreters or accurate interpreters. So in this situation, they tried to communicate via non-verbal cues and gestures, but at the end of the day, the paramedic did not get the consent from her family, or obviously the 1-year-old who was suffering, and got rushed to hospital, and a pacemaker was put in. So it's the paramedic and the practitioner were probably at fault here, not seeking the consent that they need to be ethically correct, because at the end of the day, they have done the right thing in their obligation to keep the patient alive and done the best they can, but what was ethically correct was probably not to race ahead and put in this pacemaker. So it's a hard one to go through, and if we talk about it in terms of the ethical principles in healthcare, they did beneficence, like they did actively do what was best for the health, tick. Non-maleficence, sorry, I'm really bad at saying these words. They didn't intentionally inflict harm on others in terms of physical harm, but so it wasn't intentional, so we'll say tick, they did that as well. Justice, did they treat them fair according to their needs? Yes, they did. Autonomy, this is the tricky one. They didn't allow them to make the decision, so I'd say no, they didn't meet this principle of ethics. They went ahead with the procedure without proper consent. Fidelity, they were treating them with respect and duty of all care, and veracity, they also didn't mislead them with information, they just couldn't communicate the information. So that one's a hard one to follow, but I believe they followed through with most of the principle of ethics, but that one that was hard to follow through was autonomy, just because of that language barrier, which is really hard. And that also fits into the normative ethics theory, which is broken down into duty of ethics, which is what is right and wrong. And technically, the paramedic did what was right in terms of fulfilling his obligation of keeping the child alive. But in terms of the virtue of ethics, under normative ethics, he didn't do what was right by the character of that person. That person and that family had a cultural aspects to consider, and that just wasn't considered in that split second. So like a few recommendations for the situation is, first of all, the area probably needs to invest into some good communicators if it's going to be a reoccurring problem, interpreters, and accurate ones, or they can, with less funds, they could bring in communication boards, which often help communicating between two people that don't speak the same language. So first of all, you would think interpreter would be the first way to go, but if that's a poor area, maybe that's not a consideration. But a communication board has proven to be quite helpful. It's just one of those awkward ones where it's a very quick time decision. Paramedics don't have long to decide sometimes with each patient, so they need to act on the spot. So maybe a communication board, there's not even time for that, but it should be considered. And that's really the issue of the whole matter. It's all in a matter of time. So this paramedics probably tried to do what they thought is best in that split second to save this child's life, and they have fulfilled their obligation there, but their duty to think about the child and her religion and culture probably hasn't been considered enough. But in that split second, it's really hard to tell. The paramedic thought he's done what he ought to do, but maybe it wasn't what he ought to do. So ethics is hard. He might have thinks he got it right, but at the end of the day, maybe the family didn't want it to go that way, so maybe it was wrong. So ethics, it's a hard one to discuss, and I just hope that everyone thinks through these decisions without putting their own beliefs and what they always think is right in it, because at the end of the day, it's about, especially for paramedics treating the public, it's about what they want as well, not just you. So hopefully you find that interesting and helpful. Thank you for listening.